The Washington Death with Dignity Act presented by Mariah Sullivan and Allie Westling. This policy has been in effect since 2009. It allows terminally ill adult patients who reside in the state of Washington to request and self-administer lethal medications prescribed by a physician, which is commonly called physician-assisted suicide, or PAS.
Only a qualified patient can make a written request for medication that they will self-administer to end their life. A qualified patient means a competent adult who is a Washington resident suffering from a terminal illness that will lead to death within 6 months. Additionally, only a doctor of medicine or osteopathy licensed to practice medicine in Washington may write this prescription. Physicians have a checklist of steps to carry out before prescribing any medication, and he or she must comply with these mandated steps, including determining whether a patient has a terminal disease, is competent, and has made the request voluntarily. The physician must also inform the patient regarding risks of taking the medication and alternatives to PAS like comfort care or hospice care. The most common reasons for requesting medical aid in dying were loss of autonomy, impaired quality of life, and loss of dignity. Some of the justifications in support of PAS include relief of suffering, the right to die, merciful death, and accepting death as a natural part of life. PAS is also seen as a safe medical practice because doctors can ensure death in a way that other means of suicide cannot.
On the other hand, there are several strong ethical and moral arguments against PAS. Participating in PAS would be going against one of the main components of the Hippocratic Oath, which is to do no harm. Those against PAS argue that this policy will tarnish physician-patient relationships and trust, and also require physicians to breach duties such as beneficence and non-maleficence.
Assisted suicide has been permitted in Switzerland since 1942. The Swiss Penal Code states that suicide assistance is only a crime if a selfish motive exists, and it must be offered to a person with decision-making capacity. The Swiss law does not require that the decision-making capacity be for medical decision-making, only the general ability to make reasoned choices. This is presumed in adults and older adolescents. Washington policy requires the person to be a resident of the state, 18 years old, and terminally ill with less than 6 months to live. There is no requirement in Switzerland policy for the illness to be terminal or any life expectancy limit. Travelers from foreign countries are permitted to receive assistance with suicide rather than requiring a patient to reside there. This is known as suicide tourism.
At first glance, the idea of PAS seems appealing, but not until all ethical and moral concerns have been explored is it clear that this act is not in the best interest of the American people. Patient autonomy is critical and must be respected, however, this must be balanced with other ethical principles. A physician's purpose is to heal those they can and reduce the suffering of those they cannot, not to assist in death. Due to PAS being in violation of the Hippocratic Oath, tarnishing physician-patient relationship, breaching the ethical principles of beneficence and non-maleficence, and leading to a slippery slope, it is not advisable for other states to follow suit with proposing similar acts. As a nation, it is important that emphasis be placed on caring during the natural dying process, not medicalized death.